You are listening to South Niagara Conversations, a podcast presented by the South Niagara Chambers of Commerce, along with 105.1 The River and 101.1 More FM. Here are your hosts, Dolores Fabiano and Scott Lunn.
We'll get started. Well, good morning, everyone. Thanks to everyone who's joined us for our South Niagara Conversation series. For those of you who are tuning in from afar, we represent the communities of Fort Erie, Niagara Falls, Port Colborne, Wainfleet, Welland, and Pelham. We're located in Southern Ontario, and it is a beautiful place to be. Scott Lunn is off today, but joining me in the co-host seat is Vern Milo, a familiar face and voice to all of our members. Good morning, Vern. How are you?
Not too bad, Dolores. So glad to be here today. Needless to say, the last 12 months have been profoundly historic, and in so many ways. And there's going to be much written about it, recorded about it over the next how many years. And the one of the most important perspectives is the one that we have as our topic. It's so interesting to hear it. It isn't heard enough, and I'm sure we'll have some interesting aspects to look at today. So I'm very excited.
Great. And I'm excited to have you by my side here this morning. I also want to give a shout out to our tech sponsor, Brian LaChapelle from B4 Networks, who always makes us sound so good. Brian, how are you this morning?
Fantastic. Thanks, Dolores.
Great. Thank you. So this morning, we're going to be talking to some of our frontline workers here in Niagara to hear their perspective about being in healthcare during the pandemic this past year. Vern, I know we've all been a little stressed this year, but I cannot imagine what it has been like for those folks on the front line. I'm really interested to hear about their experience. So Vern, who do we have joining us this morning?
We have a fantastic, shall we say, collection of diversity in terms of the issue. Starting with Dr. Karim Ali. He's a director of Division of Infectious Diseases and Antimicrobial Stewardship Program and Pandemic Preparedness Leader. Then we have Natalie Ferraro, who is an RN and kidney care clinic manager, Hemo dialysis unit, and she's currently moonlighting as Niagara Hospital Vaccine Clinic. Finally, we have Leslie Leduc, who's Program and Services Manager at the Extended Care Unit in Welland. Dr. Ali, let's start with you, if we may. When did you first realize that this was going to be a crisis for our healthcare system here in Niagara? And what was your thought process at that time?
So, I think the first time we kind of came to know, right, like that something was brewing, was that I always referred back to that email that we got. There is a regular list, a listserv, and that some infectious diseases, epidemiology, and other physicians get. And I got that email on January 1st, 2019. So it was right at midnight, New Year's Eve, when WHO was sent out an alert at that time. They had actually received notification from Chinese Centers for Disease Control that there has been a cluster of cases in Wuhan. Okay. At that time, there was a connection to a seafood market. So the thought was this is all just limited to that area. Although now we know, right, like that's not true. But, you look at it and it's like, oh, when the first SARS pandemic started, it was also somewhat similar. But, at that time I was in med school back in Pakistan. I didn't, so you look at this in 2019 sitting here and you think, what is this, right? So next day with my New Year's message, I passed it on to a few of my friends. I'm like, hey, I wonder if this is going to be something. And then, over the next 2-3 weeks, things started unfolding. It was, I think, January 18th or 19th when there was the first documented case in Seattle, right? Like from a returning traveler. January 25th was Sunnybrook in first one in Canada. Then, it just started from there. But, right around like second week of January, we started having conversations with our public health unit and, just trying to see what this is. But no, did not know this is what it's going to turn out to be. Yeah.
And Dr. Ali, you treated the first patient with COVID-19 here in Niagara back in, just over a year ago.
Yeah, with our medical teams, with our fabulous nurses, respiratory therapists, like we were part of that team. But yes, we were involved in the first ever case here in Niagara, and March 13th.
March 13th. And so since that time, we've had a number of patients that you've cared for. And I think the saddest part of this is families, aren't able to be with their loved ones. It's a very lonely end. And you've been, a part of that.
Yeah. Natalie and Leslie will tell you this, maybe Leslie more so when we talk about our long-term care wing, right? Like it's not, this is not how death is supposed to be, where you don't have anybody, right? Like holding up FaceTime, like iPhones and iPads and phones for them to say goodbye. So yes, at that time, we all went through a collective traumatic experience, like our fabulous staff. This is much, much bigger than just me or all of us here, right? Like this is huge. My experience, our experience here, like I can't even imagine what those families have gone through. And what those last moments for people were. But that's why the message always is, right? Like, there are people out there who still don't think this is serious, right? Like, but this is as real as it gets for all of us.
Yeah, you're absolutely right. And I think even for people who had to access, the hospital for other medical emergencies, I know that, last summer, my mom had a major heart attack, and, we called an ambulance, and she was in the hospital for almost 2 weeks. And, the paramedics showed up. They were amazing, just knew what to do, took care of things right away. But I cannot explain to you the feeling that we had as the ambulance drove away, and we were told, call the hospital in an hour and they'll let you know what's going on. It was the longest hour of our life. And, even, the 2 weeks after, we really had to depend on all of you to care for our mom, because we couldn't be there. It was very limited times that we could be there. We really depended on the nurses giving us an update over the phone. It was hard. And I think that's the thing that sometimes people forget. This is a pandemic on top of, all of the health crisis that you guys deal with every day. And Leslie, I don't know, maybe you can, give us a little perspective around that.
Yeah, I would say, especially in long-term care, it's been a real challenge. At the beginning of the pandemic, when families were not allowed in at all, and to see the emotional support that the residents didn't have from their family members being with them on a regular basis, and the difficulty that the family members experienced during that. We were really lucky. We have quite a bit of technology here in our home to begin with. And Niagara Health has been really good at supporting the technology that we had in the home. But we had a huge donation from a company that allowed us to buy 2 more iPads right away, right at the beginning of the pandemic. So we were able to kind of bump our technology up pretty quickly. So we weren't sharing, but I know other homes that I've talked to, other program managers in other homes, they didn't have the same amount of technology we had, or they didn't have the access to the internet, which is something that we had dealt with quite a number of years ago, making sure we had access to internet here in the home. And so we were lucky to be able to connect families virtually with their family members pretty close to the beginning of the pandemic. But, even as we went along, when we came to the summer months, we had members of the community build us a visiting booth. So we were able to visit out, do outside visits, but maintain that barrier with those distancing, because we still weren't doing, as Dr. Karim said, we weren't doing the masking, we weren't doing the gloves, we weren't doing the PPE the same at the beginning of this as we are now. So it's a very different, things have shifted quite a lot. And we do have essential care partners coming in now to the home. Each resident is allowed 2 essential care partners, but those care partners can be switched out on a regular basis, depending on the needs of the resident and the needs of the family at any given time. So we're really trying to work with the families to make sure they're there to support their loved one at any given time.
Yeah, that support is so important. And you're talking about technology. That never even dawned on me, but of course, that would be a great way to keep them connected with family. And you think of seniors not necessarily being savvy enough to.
They're not
right.
They're not savvy enough. So my recreation therapy staff had to really bump up their tech savviness quite quickly. Between Zoom and Facebook Messenger and FaceTime and Skype and, all of these different technology platforms that, we weren't 100% familiar with them all. Right. So the recreation therapy team here really had to bump up their knowledge pretty quick on how do we access this. And you have to remember, so the average age in our home is somewhere around 90. A little bit higher than 90 is the average age of our residents in our home. We have 115 beds, so that's quite an age. So you also have to think that if our residents are 90, how old are their children? And a lot of their children are not technically savvy either.
Right.
So that was, that's also a challenge, is how do we support the family member through this technology when they don't know a lot of the technology, or they're not comfortable with the technology.
Right. So how did you support them? That's just a great point.
You know what? It was a lot of telephone conversations, a lot of walking them through things, a lot of patience on both ends to make this work. To get them connected to Messenger, to use Facebook Messenger, or if we were doing Zoom, teaching them how to do that over the telephones. Because you have to think, if our average age is 90, their kids are, 70.
Right. I'm laughing because I'm not technically savvy, but I can, turn on a computer and I can hop on Zoom. I can figure all that out. But my kids, laugh at me and have no patience with me. So I can't imagine, a 70-year-old and their, 90, 95-year-old parent trying to.
Right. And then you add dementia in there as well, right. Because most of our residents have some level of dementia. So you add dementia in there and they can't understand, how come I can see you, but I can't touch you? And I can't, that confusion of technology is really a challenge for some of our residents. So
yeah, I can imagine. One of the things that we were chatting about just before we went live was, the messages and how the messages have continued to change through this pandemic. And, we talked a little bit about, wearing a mask, not wearing a mask, wearing two masks, not wearing two masks. What can you say about that, Dr. Ali?
So, like we were talking about this before, right? Like the only thing that has not changed, like you said, is change itself, right? We have to constantly pivot because, for all intents and purposes, right? Like this is a novel virus. This is a novel way of living. This is a pandemic. And collectively, we haven't gone through this, right? Like, so how do you, like, as science develops, right? Like, so science is constantly developing. And as it develops, recommendations change, okay? They may not be perfect. They may be very different than what you heard 2, 3, 4 months ago, but things do change. And, I guess, my colleagues here can attest to that. Like we go through this all the time in our clinical world, in our, there are constantly new treatments, new strategies coming along, and you have to pivot and make sure that you adapt to it to provide the best possible care. Now, this has amplified where this is all playing out in front of public. And, we are so, like all of us, we are used to functioning in that gray zone where things are not just black and white, right? Whereas, I guess the bottom line is we all try to find certainty in an uncertain world, right? Like, and this pandemic, everything that it has brought forward, not just the physical, but the emotional, mental health, the economic fallout of this is just constantly changing. And I have learned not to be very sure about things, right? Like you want to make sure that you convey it like this is how it stands right now. It may change, and if it changes, we'll change with it. Like we were talking about before, right? Just exactly a year ago, there was a dearth of literature, or there was no population level data about mask wearing. And it slowly started to come out. And then, we pivoted, and all across, mask wearing has become the norm. Physical distancing, masking. So I guess, yeah, like that's sort of my roundabout way of saying we're trying to find certainty in an uncertain world.
Mm.
Interesting. Natalie, if I could ask you, perhaps you can give us an update on the vaccine rollout. When did you get involved, and what's our status right now? And perhaps touch upon how is it emotionally giving a vaccine to someone? Because I don't think anybody looks at it from the perspective of the person holding the needle.
Yeah, so I was asked to join the vaccine task force and group early January from our executive vice president, Derek McNally. I was honored to be asked, to be honest with you. It's the only way that we're going to be able to get a handle on this pandemic and start seeing people's faces again and being able to provide care the way that we used to. Our patients seeing our smiles and not having all these barriers and human touch and families coming in to help heal the sick. And so I was honored to join the working group. It literally takes a village to make this happen. It's been unbelievable how Niagara Health has come together to make this happen. If you could see what I'm looking at right now, I wish I could show you, but due to confidentiality issues, I can't. It's unbelievable. It's super emotional. We opened the first mass vaccination center in Niagara on February the 17th. And now we are currently providing 1,400 vaccines per day. We're open 7 days a week. And today we'll be hitting 40,000 first doses for Niagara residents, which sends chills down my body. So it's amazing. I will tell you the first vaccine that we gave in long-term care employee and Niagara Health employees brought tears to all of our eyes. it's an incredible feeling. It's been as everybody said, a very long year. It's been very difficult on the health system and the community and families. People have lost their jobs. It's affected everybody very differently, but for healthcare, it's the light at the end of the tunnel. So to be able to vaccinate, the Niagara region and have a huge part in helping control this pandemic, it's an honor.
That's awesome.
Natalie,
That's awesome.
Can you tell people where you are? Just tell our listeners where you physically are right now.
Yeah, so I'm currently live on location. So I'm at Seymour Hanna for Patarina. So that's where the Niagara Health Vaccination Center is. So I have actually been removed from my current position at Niagara Health, which is I'm the clinical manager for hemodialysis at St. Catharines site. And I've now on location here at Seymour Hanna running clinical operations with our team here at Seymour Hanna. So this is a stadium, obviously. It's a hockey arena. So those are the stadium seats behind me.
Fantastic.
Not bad.
So how are people reacting to the vaccine? I know there was a lot of controversy around the vaccine, and some people still are not feeling comfortable with it. But what are you hearing as people are coming through the door?
I think excitement, relief. So I don't know if anybody saw CHCH News. They did a really nice article last night on our sticky notes. So if you ever come here, you can see a sea of a rainbow sticky notes. And so what our Executive Vice President Linda Boych's idea was to write how people feel about receiving the vaccine on a sticky note and putting it around the arena. And it's just grown unbelievably. Originally, we were going to take them down at the end of each day, save them and do something with them at the end of the day. And now we've just let it grow. It's literally like, it's unbelievable. It's all colorful. And my staff and I, we go and read them at the end of each night. There's thousands of them. And it's just an inspiration. There's sticky notes that say, now I can hug my mom, or I'm that much closer to hugging my mom, or seeing my kids, or going back into long-term care to see my husband. Like, it's just really heartwarming. And honestly, for the team that's worked so hard, it just proves that we're doing the right thing here, and we're continuously working hard to help, curb this pandemic for sure.
Yeah,
wow, that's fantastic. What a story, Dolores.
Oh my God, it's the hope, right? Like you said, it's the light at the end of the tunnel. There's hope, and I think we've all had moments where we just, when is this going to end? I remember watching the news when they were talking about the first variant that they found in the UK, and for me, and I think I've mentioned this on previous podcasts, that was a moment for me where I thought, oh my God, like, when is this going to end? And I think we've all had moments like that throughout the past year. But, just having this conversation this morning, it's I've got chills. I'm so happy because there is hope. And my parents have gotten the first vaccine shot. And you're absolutely right. Like, it's just waiting for that hug, right? And I think we can all relate to that. It's a good feeling.
Leslie, has the mood in extended care been the fact that we've turned the corner, and have you seen a morale up boost at all in that industry as a whole, or what's the status there?
I think, people feel a little bit of a sense of relief that the vaccines have been given. Of course, all of our residents have received both of their doses, or those residents that wanted to receive the vaccine, as well as all of our staff that wanted to have received both of the doses because of the concerns in long-term care environments.
Sure.
So we were right at the beginning of that thing. So I think you see some relief from that. Our essential care partners that have been coming into the home to support their loved one throughout this whole time that they've been allowed, most of them have received both doses, if not, if one dose at least for sure. So, we continue that as people become essential care partners, we continue to register them and get them the vaccine doses so that they are safe coming into the home. So yeah, I think you're seeing a little bit of a sense of relief, a little bit of a, hopefully this is turning a little bit of a corner, but there's still a lot of unknowns. You know, as you said, the variants are a huge concern for us. Is this, is this going to protect us? So we're still on very high alert here in terms of monitoring who comes in and out of the home, how we do things, all of the PPE that we're wearing, because we don't know some of those things. So I think that's a big, sort of still a cloud kind of hanging over us.
Yeah, that's a good point. And maybe Dr. Ali, I'll have you speak to that a bit. We're excited about the vaccine, but once you get the vaccine, you can't let your guard down, not yet.
No, we can't. And, that's true. And what Leslie is mentioning, right? Like, especially in high risk areas, not just like where Leslie, but Natalie's, where Natalie works, right? Like, so dialysis units and all, like, very, very important to make sure that that vulnerable population is protected. Yes, there are unknowns, but, good things are on the horizon. Look at BC, right? So I know BC is going through, I don't know if we want to call it a third wave, but yeah, certainly a spike in cases. But because they're long-term care residents and are almost completely vaccinated, they're starting to let people come in now, okay, to be with their loved ones. There are obviously public health measures in place, and they will be, but things are looking up. There is always going to be some unknowns, okay, about this, but how. I think I guess people are becoming tired of hearing you can't do this, you can't do this, you can't do this. Yeah. And this is time when we, as a society, as healthcare professionals, we start talking about how can we do things safely? What is it that I can do safely? Yes, going outside in beautiful weather, it's fine, right? It's good for you, it's good for everybody. We can discuss about variants, but I'll say, that's just, that's Darwinism in action, right? There was just so much virus around during, fall, right? Like, so late summer and fall of 2020, that it gives the virus the chance to mutate, right? Like, so things change. And that's a normal phenomenon. More than 90% of these changes in the virus, they don't mean anything, and it's just there. Every now and then there are some changes in the virus that makes it more infectious, so to speak, right? Like, so it becomes more efficient at transmitting. The good news is the variant from UK, or B117, which is the predominant variant we worry about, all three vaccines actually work, all the four vaccines actually work well against it. Specifically speaking, right, like Moderna and Pfizer have come out with that data. There is actual lived experience with the UK variant and Astrazeneca. Right when it was starting to run rampant and burn through UK, that's when Astrazeneca was rolled out, and they were able to curtail it, not just with lockdowns, but vaccinating massive populations with Astrazeneca. So there you are, right?
Yeah. And that's a good point that you make, because I know that there's been a lot of news around the AstraZeneca vaccine, and people who are very concerned about some of the issues that they've heard about. What can you tell us about that vaccine? And that's not available here in Niagara as of yet.
Yep. It's not available yet, but hopefully it will come across. It will come around soon. AstraZeneca vaccine is a bit different than the messenger RNA vaccine. Okay, and the first, principle, right, like, is don't compare vaccines that are available. You can compare Pfizer or Moderna if you want, because they are the same vaccine, perhaps, but you can't compare AstraZeneca, which is a different kind of vaccine. It is It is essentially a virus, a common cold virus that has been rendered non-infectious and innocuous. And it has the spike protein, the protein that juts out of this the coronavirus.
Mm-hmm.
And what it does is when it goes inside, right, like inside the body, it teaches our body to make this spike protein, and then our immune cells then fight it. Okay. The typical, it's a 2-shot thing, right? Like, and it can be stored, at a refrigerator temperature. So that's the big thing about this vaccine, because it is much more easier to transport, and existing supply chains, right? Like logistic supply chains, this vaccine has no problem. I guess when they looked at it, right, like this data, they, AstraZeneca and University of Oxford, when they put their heads together to do this vaccination trial, they actually did their trials in a much better way than some of the other vaccines, because they included a diverse group of people, right? Like, so people from different parts of the world, as opposed to just one country, 1 or 2 or 3 countries. They included different ethnic people of different ethnic backgrounds, because as you know, there is certainly a predilection for certain ethnicities or races to actually die and be adversely affected with COVID, coronavirus more. Now, the number 65% effective or 70% effective, it's, it conjures up imaging. It's like, oh, I'm getting a second-class vaccine than what everybody else got. Why would you do this to me, right? Like things like that.
Mm-hmm.
And it's important to understand that it's 76% effective at preventing symptomatic disease, which means for 34 out of 100 people, 34 out of 100 people will get a head cold, a common cold, like symptoms, and they're good to go. It is still close to 100% effective at preventing death and severe disease. And this is exactly what you need to look at when you're looking at vaccine trials. So it's comparable. Like that efficacy is the same for Moderna vaccine, for Pfizer BioNTech vaccine. You can't compare these vaccines because, one, they're different, and second, there have been no head-to-head trials comparing these vaccines. Also, I would say, right, like the trials for Moderna and Pfizer vaccine happened earlier than the AstraZeneca, right? Like AstraZeneca vaccine trials and rollouts were happening, the real life, when the variants were starting to spread. So I bet if those trials were like Moderna, Pfizer trials happened at that time, we would have seen a lower number for them too. But, just cutting through the noise, this vaccine is still close to 100% effective, just like these, at preventing death and severe disease. And that's exactly what Leslie will tell you, what Natalie will tell you. The goal is to save lives, right? Like, this is why all of this was first done in long-term cares, to just ensure that we make sure that that population is protected.
Right. And I think, as has been the problem with so much this past year, there's so much misinformation, people getting news from sources that aren't necessarily accurate. People don't know, what to believe and what not to believe. It's just a very, very confusing. So thank you so much for that explanation, because that actually makes sense to me. Natalie, are you finding that when people come to the vaccine clinic, are people asking what vaccine they're actually getting?
I knew you were going to ask that. So yes, So yeah, they ask a lot. Everybody kind of has, like you said, their own opinion on which vaccine is better. So we've only had the Pfizer vaccine here at the Niagara Health Vaccine Clinic. And again, that's due to the way that the vaccine has to be transported and stored in a frozen state. So that's why we've continued to have it here, because we have a whole pharmacy group and station set up to support all of that. So that's, I think, too, what has made this process of getting people vaccinated so difficult, because of the way that the vaccine is stored and transported and drawn up, and again, not wanting to waste anything. We don't waste any vaccines. So I think that's where, again, the community is like, well, why can't I get it at my family doctor, and why can't I get it at pharmacies? But again, those two vaccines are very specifically stored and diluted and drawn up. But yeah, everybody asks what vaccine they're getting. A lot of people have a sense of relief for the Pfizer vaccine. But again, like what Dr. Ali said, I always say to everybody, any coverage is better than no coverage. And these vaccines wouldn't have been approved by our Canadian government if they were not safe and didn't do the job that we need them to do. So everybody should just be happy to get a vaccine.
Right. I'm with you. And I'm just curious, how are you storing them? Are you just putting them on the ice in the arena? How does that work?
So they're in special -70 fridges at the hospital. So we have these caged special fridges that were ordered that store the vaccine. And then each day we have 2 drops. So in the morning, pharmacy brings in cooler freezer. They have to come in a frozen state, so they come in coolers. We do half the amount. We bring it here, and we have a fridge here where they can thaw from a frozen state to refrigerated unfrozen state. And then as we take them out, we draw up the doses. Pharmacy does that, and then they're good for 6 hours. So that's the other thing. It's not like once you draw them up and you don't use it, you could just put it back in the fridge. Once they've hit room temperature, we have 6 hours from the minute that they hit room temperature to be using them. So it just adds another layer of it being very dynamic, right? So we usually throughout the day have 3 different expiry times, 1:30, 3:30, and then 6:30. So we have to make sure, constantly surveying the floor to make sure that none of those expire by time.
Right.
So it's hard.
Do you have a standby list? So if people don't show up, and let's say you have, 20 people for some reason didn't show up and they're about to expire, do you have a list of people that you can call to say, hey, we've got a vaccine for you, get down here?
Yeah, so we have what we call a Vaccination Coordinator. So they watch the list very closely. We determine how many vaccines, how many cancellations, how many no-shows. We contact those people. We usually give everybody about an hour to an hour and a half if, let's say, there was a miscommunication, to come in. They're calling people. And then kind of at the end of the day, if we do have cancellations, then we put priority groups according to the ministry guidelines. Obviously, we follow all the rules, onto a reserve list. So these are people that say, yeah, I can come anytime. Like I work at a place, like even at the hospital, some people can leave, they don't have a full nursing assignment. They might be, a social worker and don't have any patients that they need to see at that moment, or, an occupational therapist, that they can leave the hospital to come here and get vaccinated. So I'm happy to say we've never, ever at the end of the day wasted a dose because we couldn't find a correct arm to put that vaccine in.
Sounds like a very fine-tuned machine, and
it is.
The logistics are incredible. Congratulations on doing the job that you're doing. That's
oh, thank you.
I want to come back to you, Dr. Ali. Just want to pick your brain a little bit. Do you think that we are here in Niagara, excuse me, in a third wave?
So not Niagara per se, right? But we are closely watching as our numbers are not where we want them to be, right? There are certain other indicators that public health monitors, right? Like test positivity and all. They haven't dropped, or, in some instances have started creeping back up. But, we are only as safe as our neighbors, I like to say. So looking at Hamilton has become the second most, the one with the most incidence of cases. So it's number 2 right now. And historically, we have always been a week to 10 days behind Hamilton, or 2 weeks behind Hamilton in terms of rising cases. So, our Chief Medical Officer of Health, Dr. David Williams, right, like for Ontario, has said, we are in a third wave as collective, and but Niagara per se, right, like it doesn't look like it right now. We are not there yet, but it won't take much, unfortunately.
So it's a race to get as many people vaccinated.
It is exactly a race to get as many people vaccinated as quickly as you can, and just all of us doing our part. The issue will also be, it has literally come down neck to neck with the spread of variants, right? So overall in the province of Ontario, 60 to 70% of samples of the virus, they are positive for a variant, either one of those three variants. So, I understand it creates a lot of anxiety and all, but you just need to understand the way out of this is to vaccinate the population and continue to follow the public health guidelines as they stand right now. So yeah, we may not be there yet, but we are unfortunately starting to see some increase.
So a tough question for you, but we're just having a conversation. Do you think we might end up in another lockdown, depending on this third wave and how it hits Niagara?
Yes, it's a tough question, right? Like if I, this perhaps, right? Like if there is a lockdown, like obviously, I don't make those decisions.
Yeah.
And, if you ask me for cold, hard facts, like do lockdowns work? Absolutely, they do. Okay. My colleagues, Ms. Leduc here, Ms. Ferraro here will tell you, right? Like how destructive this was, like this dark winter that we came out of. And what Ms. Ferraro told you, right? Like when we gave the first shot, all of us were crying. And we had to change our masks because they become soaked and then you have to change your masks, right? But no, that was like, there was a vaccine delay, right? Like it took time for us to have the vaccines. But finally, when it came through, right, like we just showed Niagara, we just showed the province, right? Like in Canada as a whole, what we can do. Niagara Health, Niagara Regional Public Health. This lockdown, if it happens, perhaps would be hopefully a lockdown to end all other lockdowns, right? Because right now, like when we went into first lockdown a year ago, we didn't know what we are heading into. We had no idea, right? Like some of us here, you just look at things and you're like, okay, maybe, we just don't know. You're hearing all these horror stories coming out of Italy and now New York. So let's get our, wills, right? Like living wills and all in order. You don't know what's going to happen, right? But this time around, it's different because we have 4 highly effective vaccines available. So even if we do, I hope it's short-lived. I hope, we vaccinate as many people as we can so we can come out of this. Lockdowns, like we were discussing, they are not the most ideal, and they should be they are usually a sort of a measure of last resort, right? Like desperate times require desperate measures, and that's exactly what it would be. Because definitely, lockdowns have an effect on people's mental health, our children's health, right? Like that's something that weighs a lot. I'm pretty sure our public health units, our ministry, our premier's office, it weighs heavily on them when they think about these things, because these are not easy decisions.
I'm sure, and I think sometimes people forget that. This is a worldwide public health crisis, and these decisions aren't made lightly. And you're right. the premier certainly doesn't want to stand up there and say, okay, we're going into a lockdown. Nobody wants to see that. But it just is a reflection of how dire the situation is. And I think, we need to understand that.
Agreed. And, I'll say this, right? Like, it's not easy for me to talk about, but like, I'll say, it's not just like, thankfully, I have a good job. I have a stable job, right?
Yeah.
I have a family with me, right? Like my kid, my wife. Most people don't, right? Like, and this is where it hurts the most. In lockdowns, when they happen, it's the people who can't work from home are the ones that have been most affected in those lockdowns. So there is, we have to think about that part of our population. What are we doing to keep them safe? How is it going to be different from other lockdowns besides vaccination? Do we have paid sick days and all, right? Like, that's all so very important. And when people talk about like lockdowns don't work and all, when you look at case by case, right? Like, it does definitely work to bring the cases down, but it hurts a lot of people, right? Like, and I acknowledge that. I realize, right? Like, I am not in that situation that a lot of our population is in, and that's the sad part of this pandemic.
Yeah, you're right. We've heard so many stories, and we've had so many conversations about that. And I think the important thing is, to take the lessons that we've learned and to make sure that we have a plan in place. God forbid this happen again, but we can't be so naive to think that it won't. And what do you think about that? Do you think we'll see something like this again in our lifetime, Dr. Ali?
So when we were training in infectious diseases, right? Like, we were always trained, or we always knew there is this disease X, right? Like that may pop up just because of how closely the human population is interacting or and coming in contact with the animal world. So these things keep happening, right? Look at DRC and the Ebola outbreak that's going on there. It's controlled, thankfully. We may see this, right? Like, and it all depends. Like, there should be a collective effort, right? Like with WHO and other health authorities around the world to come together to have a pandemic plan in place, right? To be prepared for future pandemics and control them right where you can. And Ebola is a very good example of this now. It has ravaged since 1976, right? Periodically. And now we are seeing it more frequently. In 2014-15, then back in 2016, and then last year, and then this year, we saw the DRC outbreak. There are effective vaccines. So, like you were mentioning before, there are platforms now for safe and effective vaccine manufacture, like messenger RNA, that would help us pivot to those very, very quickly. But, if you have a crystal ball, like you would say, everything should be so that we prepare for the next one, and not let our guard down, not just let this all go to waste.
Yeah, that's good advice.
If we did look for a silver lining in this uncomfortable experience, shall we say, when it comes to each one of you, be it medically or extended care or even vaccine distribution, what do you think the major gain has been from our experiences over the last 12 months? So just as a wrap up, what would you say that is, and how is that putting us in a better position than otherwise? Let's start with Natalie. What do you see as a major gain?
I think just the whole process together, we've learned a lot from this experience. I think we've learned how to handle, we've learned different infection control practices. We've had to redo policies and procedures. Everything that we knew before, we had to make some adjustments to. I think for me, the biggest thing was that our community came together and supported one another in this difficult time. It was unbelievable to see how much the community came and supported frontline employees at the hospital. It was really heartwarming. And again, Niagara might be small, but we're mighty. And together, you know, with the community and with the healthcare, we're going to fight this and we're going to come out at the right end of this. And I think that's probably the biggest learning for me.
Wow, that's great. Leslie, what do you see?
I think being in long-term care is just, you know, the light that this has shone on long-term care and the needs that we have to look at. How are we caring for our seniors? And what are we doing with our long-term care environments? I mean, thankfully from this, for us, one of the huge things is that we are getting a new build. So we are part of the announcement that we are getting a new long-term care home. 128 bed home built here in Welland as part of Niagara Health. And so, you know, that's a huge thing. So, I mean, that for us is really exciting to be part of that whole redesign and take the things that we've learned from this experience in terms of how do we build environments that will help protect our, you know, our elderly as we care for them, should something like this ever happen again. So we're building the right types of rooms, we're building the right types of environments, you know, that we're doing the services that we need. And I think looking at our staffing in long-term care from this as well is huge. And the light that this has shone on the need to really look at how are we staffing our long-term care environments to care for our seniors. So I think although that it's been a very, very difficult challenge, one of the positives would take that, you know, we are going to do better.
Wow, that's awesome. And finally, Dr. Ali.
I just, you know, I'm speechless at like what message, right? Like, and what have we learned? I think the most important thing I would say is, you know, you gotta learn to cherish every moment, right? That's one. The other is, you know, empathy and kindness with people, because everybody is struggling. You got to understand, you know, people, it's just not going to be perfect. We just have to do things. And, you know, whatever choice people make, you just have to be kind to them, right? Like, and understand that everybody is going through a collective traumatic experience. And, you know, we've all had loved ones affected by this directly or indirectly. And it just comes, you know, it just shows you the fragility of life. So just, you know, be kind. And right now is, you know, the end is in sight. So, you know, we are better prepared now than we were before. So making sure this home stretch is worth it. So that's sort of my message. I think empathy and kindness all around. And don't forget the people in Niagara, people in the world, right? Millions who have died of this and continue to die.
Wow, what a great conversation, and you know, three great leaders. You know, each and every one of you doing your share for this, and to hear you speak about offering kindness and empathy to others, that's fantastic. Thank you so much for all the work you're doing. Needless to say, I don't think we can say thank you enough times. And Dolores, what do we have planned going on to our next meeting?
Yeah. Well, first of all, thanks, Vern, for being such a great co-host. It's nice to have you not next to me physically, but joining me on the podcast. And thanks to all three of our guests for caring and for being on the front lines during one of the scariest moments in our history. We just really can't thank you enough. I have so much respect and gratitude to all three of you and to the rest of your colleagues. Next week, we're going to be taking a break, but we'll be back live on April 9th. Scott Lunn will be back as well. And we'll be hearing from 3 very cool businesses here in South Niagara. They're going to share the good, the bad, and the ugly about their businesses during the past year, as well as their plans for a bright future. Joining us for the conversation will be Kevin Reels from Series Global, David Norquist from Mini Wargaming, and Antonetta Kulik from the Fort Erie Racetrack. 3 South Niagara superstars. Can't wait. To all of our listeners, send us the topics that you're talking about because we want to talk about them too. Thanks again for tuning in and have yourselves a wonderful day.